Hi everyone, my name is Sydney. I'm a third-year nursing student taking my nursing elective through BCIT, the Breastfeeding Experience. Today I will be discussing the challenge of engorgement with twins. This video is intended for other nursing students, and today I will be discussing the pathophysiology of engorgement, some of the risk factors, signs and symptoms of engorgement, judgment using the 3 rules, interventions, as well as evaluation of the outcomes. I will be utilizing the clinical decision-making framework to help guide my discussion and my decisions. So here's the clinical decision-making framework that I will be using. First, we'll go through knowledge, pathophysiology. So normally at 2 to 3 days postpartum, women will experience a feeling of breast fullness with normal milk flow and soft elastic breast areola. This is completely normal. What leads up to the feeling of fullness of breast is when the prolactin hormone increases in the immediate postpartum period, paired with an increase in milk volume. Engorgement occurs when the milk is not removed and the breast alveoli become distended. The distension of the alveoli impairs capillary blood flow and leads to congestion and leakage to the surrounding tissues, which is resulting in edema. This edema will lead to milk duct compression, ultimately leading to a decrease in milk flow. So then this can solely persist to severe breast engorgement, and that is when there is severe pain. It can lead to blocked ducts and progress to mastitis, which is an infection of the breast. It can also decrease milk production if treatment is not applied. So there are some factors that contribute to engorgement with twins. Because there are 2 babies, there are more supply and demand with the milk. Extra stimulation can be causing the mother's milk supply to be increasing past the balance of supply and demand, and the supply may not be removed as effectively. The milk is as high as the supply because when you think of it in regards to twins, they are often prematurely delivered. So developmentally, they may not be effectively removing milk from the breast. That could be related to decreased muscle strength and energy for an effective latch and suck. Additionally, there may be some separation between the babies and their mother because they may be requiring a stay in the NICU. Other factors could be a lack of social support. The mom may decrease her frequency of feeds or even miss feeds without that social supportive person. You can only imagine how tiring it is with twins to have that support in place. Engorgement can also occur if there is an abrupt stop in breastfeeding without pumping. So this could be if the mother is introducing solids too soon to babies, or if the babies are sick and not feeding well. Other socioeconomic barriers could be lack of knowledge or a lack of cultural norm support. Say at work, there isn't a culture for breastfeeding, like using the pumps. So next is cues, and this is when you do your assessment. So things you want to look for in the mother's breast are firmness, tender and pain, warm to touch. There could be a shiny appearance, it could be taut, areola, or firm. There are flattened nipples, a slight increase in temperature, like a low-grade fever, tender and swollen lymph nodes in the armpits. Based on the assessment, you have to make a judgment on what's going on overall. So the mother is experiencing pain, decreasing the amount of breastfeeding for her infants. The mother may be having a negative experience with breastfeeding, which can lead her to switch to formula, and then she could be having an altered confidence with her mothering capabilities. The babies are having an ineffective latch from the flattened nipples, which can lead to inadequate nutrition. So you want to look at the relationship. The pain could be leading to a decrease in skin to skin, a decrease in the bonding experience, and then also a decrease in the breastfeeding duration. So some priorities that I'd like to highlight are the rules. The first rule is feed the infant. You as the nurse want to encourage breastfeeding at the mother's breast to help release the supply and help the baby's nutritional intake. You want to assess the babies are getting enough food, encourage the mother to increase her frequency and duration of feeds, assess the latch, suck, and swallow for the babies, help with positioning the babies at the breast, educate the mother about identifying feeding cues such as opening the mouth, bringing the hands to their mouth, sucking at their fists, smacking their lips, and even crying, which is the late sign for hunger. Next, you want to move the milk, which is the next rule. If babies are having an ineffective latch and suck at this time, it would be important to educate how to hand express and use the breast pumps to help overcome this obstacle. Pumps and expression are an effective way to stimulate the breast so that the milk production is not being compromised in the case of separation in the NICU, or if the babies gestationally or developmentally are unable to feed at the breast. Hand expression methods should be taught early on to help protect the mother from engorgement and also blocked milk ducts, which can lead to mastitis. Expression can additionally help to increase the supply of breast milk. And then the third rule is help the dyad learn to breastfeed. When breastfeeding complications such as engorgement occurs, the nurse should help try to facilitate a positive interaction while troubleshooting complications. Skin-to-skin encouragement is really important to help with the bonding between the mother and her infants. And there are also so many benefits for the application of skin-to-skin. Nurses should be helping to facilitate a comfortable position for the mother and her twins to help enhance this experience. Education around the best time to breastfeed is often during the quiet alert state when the babies are just waking up and calm. Education around the mother settling the twins before feeding is important, and as well as settling herself. During this time, it is also important to encourage the mother to help empower her. Even just little encouragement into the right direction will help facilitate a positive experience. So are the interventions. So you want to make a decision on what fits the individual and the baby's best. You want to help encourage frequent feeds every 2 hours, and with the twins you can have one baby empty each breast. You want to educate the importance of wearing a nice supportive bra that's not too constricting or tight. The use of cold compresses when not feeding can also help. Prior to feeds, taking a warm shower or placing a warm compress onto the breast and massaging the breast may also help. Using chilled cabbage leaves can help with the pain and engorgement, but it is not recommended more than 2 to 3 times because that can actually decrease the milk supply. Softening the nipples prior to breastfeeding through hand expression is an effective way. The use of anti-inflammatories such as ibuprofen can help decrease swelling and pain, and sometimes fever and soreness can be experienced, so ibuprofen will also help with this. So you need to consult with the doctor to help prescribe these after feeding. If the breasts or nipples are feeling uncomfortable, you can again apply the cool compress to help with that. So the final important piece is evaluation. You want to look at, has your teaching been effective? Has the information been taught appropriately for the learning style? So some like demonstrations, pamphlets, discussions, or even hands-on experience. Have they reciprocated the information through the teach-back method? Do they know how to prevent breast engorgement, how to identify the signs and symptoms, and how to troubleshoot it if they're home? Do they have the supports and resources in place that if they are experiencing engorgement frequently and it's unresolved, these supports can be lactation consultants, online resources, nurses hotline, or even a family doctor to consult. And finally, you want to give an opportunity for the mother to ask additional questions that haven't been covered adequately for her understanding. So in conclusion, a mother with twins may face breastfeeding challenges that cause pain, decrease bonding experiences, and consequently lead to the choice of formula feeding. Us as nurses have an opportunity to help support these mothers with education and interventions that fit their lifestyles to help overcome these obstacles, such as engorgement. It is important to discuss prevention early on to help avoid engorgement altogether. The greatest way to prevent engorgement is through the emptying of breasts fully. Recognition of the signs and symptoms of engorgement is key to help prevent complications associated with it. Early identification of the signs and symptoms can also help with the initiation of early treatment, leading to a faster recovery and more pleasant breastfeeding experience. I hope this video has been helpful for you guys and you can use it in your future practice.